First of all, we will discuss about the anterior cranial fossa and its boundaries. Its boundaries are, this one is its anterior boundary and this one is its posterior boundary. Anteriorly and on the sides, it is bounded by the frontal bone, and this one here elevation is the anterior frontal crest, and its posterior boundary, posteriorly it is bounded by, this one is the lesser wing of sphenoid, this one is the anterior clinoid process, and this one is the anterior margin of sulcus chiasmaticus. Now discuss about the floor of anterior cranial fossa. This one is its floor in the median plane. This one is median plane. In the median plane, it is formed anteriorly by the cribriform plate of ethmoid bone. Here is ethmoid bone and this one is the cribriform plate. When we zoom out, here we can see small foramina. These are the foramina which connect the anterior cranial fossa with the nasal cavity, and the olfactory nerve passes into the anterior cranial fossa through these foramina. Posteriorly, here is superior surface of the anterior part of body of sphenoid. On each sides, floor is formed by the orbital plate of frontal bone. You can see this is frontal bone and it turns into the orbits, and here it forms the orbital plate of frontal bone. It is completed posteriorly by the lesser wing of sphenoid.
The topic of our discussion is medial cranial fossa. This is the middle cranial fossa. It is bound anteriorly by the anterior cranial fossa and posteriorly by the posterior cranial fossa. The boundaries of the middle cranial fossa are anterior boundary, posterior boundary, lateral boundaries, and it also has a floor. The anterior boundary of the middle cranial fossa is formed by the lesser wing of the sphenoid right here and here. It also has a tooth-like projection which is known as the anterior clinoid process. The anterior clinoid process gives attachment to the free margin of the tentorium cerebelli. Beneath the anterior clinoid process is the optic canal. The optic canal acts as a junction and it communicates the middle cranial fossa between the optic cavity or the orbit. Other than that, the posterior boundary is formed by the petrous part of the temporal bone right here, and also by the dorsum sellae, which is shown right here. They form the posterior margins of the middle cranial fossa. The floor is formed by this portion here anteriorly by the greater wing of the sphenoid bone and also by the squamous part of the temporal bone. Some part of the anterior margin of the petrous part of temporal bone is also involved. Other than that, the floor also involves a central portion of the body of the sphenoid, which consists of the sella turcica. Sella turcica means a Turkish saddle, and also the dorsum sellae, and it consists of a diaphragma sellae present right here. The function of the diaphragma sellae is actually that it is a form of dura mater which covers the pituitary gland. It contains a circular opening to allow the stalk of the pituitary gland to pass through, so it is not avulsed during any kind of injury. Other than that, the middle cranial fossa consists of 4 different openings. The first opening right here is known as foramen rotundum, which allows the passage of the maxillary division of the trigeminal nerve. Then is the foramen ovale, which allows the passage of 4 different structures, which involves the mandibular nerve and the lacrimal nerve, emissory veins, and accessory meningeal artery. Other than that is the foramen spinosum right here. It allows the passage of the middle meningeal artery. Also along this margin is the foramen lacerum. It allows a small passage of the of a plexus, the pterygoid plexus. And along the lateral margins, there's the presence of carotid canal. Beneath this lesser wing of the sphenoid, right here is a passage right here. So it's not actually that visible. It is known as the superior orbital fissure, and it allows the passage of a variety of structures which mainly involve the ocular muscle nerves like the oculomotor nerve, trochlear nerve, abducent nerve, lacrimal and nasociliary branches of the trigeminal nerve, all pass through the superior orbital fissure.
The topic of our discussion is posterior cranial fossa. This is posterior cranial fossa and it is the largest of all the fossas. First of all, we will discuss its boundaries. The anterior boundary of the posterior cranial fossa is formed by the dorsum celli, which is a part of the sphenoid bone, and this is also formed by the superior border of the petrous part of the temporal bone. The posterior boundary is formed by the squamous part of the occipital bone. This is the squamous part, and on each side it is formed by the mastoid part of the temporal bone. This is mastoid process. And then this is the mastoid part of the temporal bone, and it is also formed by the mastoid angle of the parietal bone. Mastoid angle. If we discuss the features of the posterior cranial fossa, there is internal occipital protuberance here. Internal occipital protuberance. On the lateral side of the internal occipital protuberance, there runs the transverse sulcus, which lodges the transverse venous sinuses. The transverse venous sinuses continues as the sigmoid sinus on the mastoid part of the temporal bone, and the sigmoid sinus continues as the internal jugular vein and runs in the internal jugular foramen. The floor of the posterior cranial fossa is divided into the median part and the lateral parts. The median part is formed by the clivus. It is a sloping area behind the dorsum celli. This is clivus. And it is in the middle, it is formed by the foramen magnum, and in the posterior part it is formed by the squamous part of the occipital bone. The lateral part of the floor is formed by the lateral or condylar part of the occipital bone. This is the lateral part, and it is formed by the posterior surface of the petrous part of the temporal bone. This is the posterior surface, and it is also formed by the mastoid part of the temporal bone and the mastoid angle. If we discuss the further openings of the posterior cranial fossa, there comes first the internal acoustic meatus, which lies on the posterior part of the petrous part of the temporal bone. Internal acoustic meatus lodges the facial nerve, vestibulocochlear nerve and the labyrinthine artery. Just below the internal acoustic meatus lies the jugular foramen. It lies in the petro-occipital fissure. The jugular foramen lodges the 9th, 10th and 11th cranial nerves, posterior meningeal artery and the sigmoid sinus. And just below the jugular foramen and a little above the foramen magnum, there lies the hypoglossal canal. Hypoglossal canal lodges the hypoglossal nerve, which is the 12th cranial nerve. On the median plane, there lies the internal occipital crest. It gives attachment to falx cerebelli, which separates the two cerebellar hemispheres, which lies there. Foramen magnum, which is the largest foramen in the skull, lies in the posterior cranial fossa. It is narrow in front because it is marked by the occipital condyles, which lies there. These are occipital condyles. This makes the anterior of the foramen magnum narrow. It lodges the medulla oblongata. Medulla oblongata passes from here. It also lodges the vertebral arteries and vertebral venous plexus and the spinal roots of the accessory nerves.